Hi, this is Nurse Angela with Angela's Student Nurse Toolbox. I'm going to talk to you today about understanding fetal heart monitoring. If you are in maternity clinicals, uh, you want to have at least a basic knowledge of what you're looking at on the fetal monitor and know when to respond and how to respond. So, our first strip is some basics of fetal heart rate monitoring. So, you'll see in the blue highlighted area, that is the fetal heart rate. Normal fetal heart rate can be anywhere from 110 to 160s, 170s. You'll see that there's some rises and elevations in this heart rate. It's not a flat line. Okay, that's what we call variability. It goes up and down and has movement to it. The bottom, you'll see these hills where the arrow's pointing. These are your contractions. They look like little mountains. With an external fetal monitor, it's just showing that they're having a contraction, not how strong they are. So let's look at the next slide. Baseline fetal heart rate. This is what the heart rate looks like average time between contractions. So if you look at this one, the number was 150. So most of the time, the heart rate's been in the 150s. So that would be your baseline fetal heart rate. That's important to know because if that changes, maybe something's going on with the baby. Accelerations. This shows that you have a happy baby. This one's pointing to an elevation of the heartbeat. It's going up. It's responding well to contracting at the bottom. You see the contractions. We want to see that as a healthy sign that everything's okay during labor. So you want to see some accelerations, and that's a rise in the heartbeat. Early decelerations. This is where it kind of dips when you have a contraction. So at your peak of your contraction, so the top of the hill, I have a little bitty indentation. It drops a little bit the heart rate. Those are called early decelerations. That means the baby's starting to move on down, go in the right direction. Okay, so that's all that sign is. It's just moving on down. So maybe we're getting somewhere with our labor. So that's a positive sign. Variable decelerations. These are those highlighted big V's. It could be W shapes, V shapes, U shapes. This could mean that there's some cord compression. So baby could be playing with his umbilical cord. The cord can be getting compressed as the baby's moving on down in response to being squeezed with each contraction. We get concerned when they get really low, okay, and the baby is not ready to deliver yet. Sometimes this might happen after we break a water bag. And we might have to do a procedure called an amnio infusion where we have to hook up an internal uterine pressure catheter device, slide that into the uterus, and hook up some IV fluids to give some extra cush in the uterus so the baby's not up against the cord. And that's called an amnio infusion. Sometimes we have variable decelerations when mom's getting ready to push as she gets closer to delivery. And with every contraction, if I see a little bitty variable, that's a sign that maybe I need to go check mom, do a vaginal exam, and she's probably 10 centimeters and baby's ready to come out. So that's usually a sign, especially if moms have an epidural and they might not feel that pressure that the baby's right there. If the heart rate starts doing this with variables, with all the contractions, it's time to go check mom because she's probably ready to push. The next one are late decelerations. This is where you have the peak of the contraction. So you'll see where it is that contraction where it's in red, the peak of the contraction, so the top of that hill, the heart rate starts to drop. Okay, then it goes back to normal. Mom has another contraction and then it drops again. This is a sign of uteroplacental insufficiency. So that means the baby's not getting enough oxygen. It's not tolerating labor well. Sometimes when we have this, it might be if mom has Pitocin on, an IV drip to augment her labor. It might be too much. We might need to turn this off. We might need to turn mom on her left side and put oxygen on mom to help the baby to see if this gets better. Because if these continue, it might be a choice that we need to do a C-section. The next one, this is a very big late deceleration. If you look at these contractions at the bottom, each one of those lines where the blue arrows are is a minute. So it's a minute between each contraction. And look how close these contractions are. Normally, we want contractions 2 minutes apart to be able to go and change somebody's cervix and dilate them. These contractions are one on top of another. They're too close, and that baby's getting squeezed and squeezed and squeezed with each contraction, but it's not letting up enough for that baby to breathe in, get a little bit more oxygen, get that heart rate back to normal. So this is called a prolonged late deceleration where it drops in the heart rate. So this heart rate actually drops down to the 50s. So this is a sign we need to get this baby out now. Okay. If mom was on Pitocin, I would be turning that drip off right now because those are called tetanic contractions because they're back to back and there's no rest for that baby to get oxygen. So this is called a late deceleration, and more than likely we would have to do an emergency C-section if we can't get that heart rate up. I hope this helps you understand fetal heart rate monitoring. Subscribe and like my channel if you want to continue seeing more videos and access to whatever resources I can provide. Good luck.